Hi, this is the story of my lumbar spine. I had previous lumbar surgery and fusion at L3-4 before receiving ESP artificial discs. I had a bulge at L2-3 and an annular tear and disc herniation at L4-5. L2-3 and L4-5 were not previously operated on. I consulted with multiple ESP surgeons who all agreed I was a good candidate. They agreed the levels surrounding the previous fusion at L3-4 should receive the ESP ADR. My main symptoms were severe low back pain, couldn't tolerate sitting or standing long, and I was extremely flexion intolerant. I had constant muscle spasms, and physical therapy was not helping. The issues I was experiencing prior to ADR never went away and were made worse after the ESPs were implanted. I'm roughly 5 years post-op now. Just about any movement of my lumbar spine is painful. My low back feels like I've been in a bad car accident and feels unstable at times walking on uneven surfaces. I experience a constant aching pain in my low back, and the pain makes my hip flexors, hamstrings, knees, and feet extremely sore and tight. My low back frequently pops and cracks after getting up from a seated position. Sitting for more than 30 minutes is very uncomfortable, as is standing or rounding my back ever so slightly. Every morning when I wake up, I have an extremely hard time putting weight on my feet, and the low back pain is severe. I do mild physical therapy stretches weekly, but nothing helps alleviate the pain. When storms move in, or there are big swings in the barometric pressure, the pain always gets worse. On my most recent CT myelogram, I've noticed there are some holes forming in the vertebrae around the ADRs. I was never told or shown these holes were forming, which may be a sign of osteolysis or cysts developing around the ADRs. I was also never warned of this possible complication. Thank you for your time and listening.